What's good, everyone? This is Dr. Nee Darko. Make sure you hit the subscribe button below so that you're always up to date on the new uploads as well as alerts on this show. The other thing that you can do to help build this community is make sure you leave a comment below. Let us know what you like, what you don't like about the show, and ultimately, let us know who's winning these arguments, because I need to know that I'm beating Renee in these debates. Run the tape.
Aren't there some pre-existing conditions that could potentially stop you from ever getting a policy, even as a medical student or resident? Talk to us about what happens in those cases.
Yes. So when you apply for insurance, they will either turn you down or put an exclusion on a policy for a pre-existing condition, or they're going to accept you. So now let's say you apply first and either get turned down or get an exclusion. You're no longer eligible for that guaranteed issue. So if you do have some health issues, you want to talk to us first, and we can discern maybe you get that first, and then so you can at least get the coverage. So typical exclusions, probably the biggest one that we see is mental health. If you've
That's
taken,
what I want to talk to you about.
Yeah. So that is huge, and it's becoming even bigger. I'd say probably, at least in my anecdotal experience, probably about 1 in 3 physicians is on some kind of ADHD, antidepressant, some kind of medication. So if you're currently taking that, they will exclude that from your policy. And that's pretty typical. It doesn't preclude
when
you
you say
from,
exclude, when you say exclude, what does that mean, exclude? Like,
so meaning they will not cover mental health claims. So if you go on a claim for depression, anxiety, addiction, they won't cover that if you have that exclusion on the policy. So if you don't have that exclusion, they'll cover it just like any other condition. Now it doesn't mean it won't cover Alzheimer's or neurological. It's psychological. That's not covered. Because a lot of people have that question too. They say, oh my God, well, what if I get dementia? What if I have MS or something? No. That's all covered just like any other condition. So, but that's a really typical exclusion.
Here's one that I think a lot of people don't think about, IVF. What's the scoop on that?
So if you get your policy, pregnancy is covered, just like any other medical condition. If you're put on bed rest, you still have a 90-day waiting period till it kicks in, but it's covered. Now, if you're applying and you're freezing your eggs or you're going through IVF, they're going to exclude pregnancy. However, look at me. However, if you get a pregnancy exclusion on your policy, after you give birth, you can just apply to take that off. That's really not a big deal. And when you think about it, of all the exclusions, I think pregnancy is probably the most benign because you're pregnant for 9 months. You have a 30-day wait. You don't find out. The maximum amount of claim is probably 5-6 months anyway. So, but it does also cover any kind of complications at delivery. So if you have, I've had a couple of people who've had claims, they've been out for like 2 years after having major complications at delivery. That's all covered too. So if you're going through fertility, they're going to exclude it. If you get your policy before, you don't have to even disclose it later. You can even be pregnant when you increase your policy. They don't need to know it.
I think I was pregnant when we.
Well, you had your plan.
I had my policy
before you got pregnant.
Yeah.
You know, we encourage now docs to, with mental health becoming more of a acceptable thing to seek treatment for publicly, at least. We're encouraging more people to either see a therapist, speak to someone, any of those type of things. Like, let's say you don't go on medications and so forth, but you're like seeing a therapist or.
That's usually not a problem. That's usually not a problem. I do tell people in those cases, sometimes you're better off just paying out of pocket, not running it through your insurance.
Jamie, let us know why. Why? Talk to us. Talk about that. Come on now.
And use
we get into the good stuff.
Use a different name. No, I mean, sometimes people do that because so many people want to go and seek help.
I got a feeling Jamie has done that with restaurants too. You be doing some dine and dash in Denver?
No comment. So, no, but I mean, so sometimes so many people want to seek help just for getting through normal life stuff. There's nothing wrong with that. Now, if you're just, I've had clients who, they had a spouse die or they've had some just trauma or something and they're getting help. That's usually not a problem. If you've been taking medication for a long period of time, they're probably just going to exclude it. So that's just, now this is better than the way it used to be 10, 15 years ago. If you'd ever taken medications, they would just decline you. They would just turn you down. And I don't think that that's right. I personally, what I've seen, I think people who actually do seek treatment and do get help are probably mentally better off anyway.
Yeah.
And so in my
Right.
estimation are probably less likely to file a claim,
Right.
you know?
Right.
And
I have a
It was almost like the Wild Wild West days where
Yeah.
you can do, the insurance companies could do anything basically.
Yeah.
I have a friend of mine who we've talked about.
She's really a friend?
Yeah, she's really a friend. But she would like to get into doing locums, which means that she would have to get her own disability insurance policy. And she had suffered from depression in the past, and her physician literally gave her samples, just samples of lithium, which she never actually really went on. And she's afraid because she's tried to get disability insurance, and that has been either she's been denied or that part has been excluded. And actually, I think she's just been flat out denied.
So
Is there anything that you would say to her?
Yeah, in those circumstances, we like to fight it. So I go back to the underwriter. We get a letter of clarification from her doctor saying, here's the deal. These were samples. She never used it. Or, so I always try to fight those. The other thing you can also do, and that's why sometimes it helps to have somebody experienced who's sort of on your side and advocating for you. You can also say, what's the period of reconsideration? They might say, once you've been off meds for 2 years, we'll reconsider you. And then you can apply again. So it's not the end of the world. There are also alternative policies that we get through, like Lloyd's of London, Peterson's, that they likely will accept her. So it's a different policy. It's only a 5-year policy, but it's better than nothing. So, and then there's also sometimes association policies. If she's a member of a physician association, she might be able to get. So there are other options that she might be able to have.